Hello, everybody. We are back for another episode of Meet the Owners. I am super excited to be here with you guys. This week we have Brittany Jenkins joining us, somebody who I actually met last year through one of our events, and so I am excited to be bringing her onto the show to talk about what she does. As people join, please feel free to ask any questions you have, either for myself or for the owners that are joining us. You can use the comment below, or you can use the little question bubble there as well, where you can send out questions. Just let us know, if you have anything that you want to talk about. If there's people we need to know about too, drop those in the comments as well. Also, always feel free to send us DMs and things like that. We're going to get the episode started in just a moment. Don't have very many updates for you guys this week, but just remember that vendor applications are open for our third annual MGB Culture and Community Fest that's here in Birmingham, Alabama. But all vendors are welcome to join us, whether you're here in Alabama or beyond. We would love to invite you to our city to kind of show what you're doing and hopefully bring your business to Birmingham. Other than that, just be sure to be on the lookout for things. Our second quarter publication, which is really our first quarter of the year, publication is out. It is all about food and food culture and how it relates to Black communities. Food is such an integral part of our community. It's a huge part of my life. And so I thought it was only best to kind of revamp our quarterly publications and start with that one. So yes, you can get that digital or print. It's on sale now, and everything that you spend with us, a portion of that goes back towards the MGB Foundation, which is there to support Black-owned businesses and organizations, providing them with grants and educational and developmental opportunities. So please support businesses. If you're not listed, go ahead and get listed with us. But that's really it. So I'm going to go ahead and get the episode started. Again, please remember that you are always welcome to ask questions. And if you don't want to ask the question here, you can always send me a DM or the business that joins. Hey, Brittany, how are you doing?
Hey, I'm doing well. Thank you so much for having me.
I am excited to have you. I feel like I don't know you that well, and I want to get to know you and kind of what you do. I think your business is super interesting. So we're going to go ahead and dive in. Just tell me a little bit about yourself outside of the entrepreneur and public health person that you are.
Thank you so much. And yeah, we've met a couple times, but we haven't had a chance to really sit down and talk. So this is great. But a little bit about myself outside of business, because I love talking business. I'm actually an Indiana native, born and raised, and we just moved to Alabama within the last year from Madison, Tennessee. It's right outside of Nashville, Tennessee. So I, love community service and serving communities. And I have a 1-year-old little girl named Gianna. And my husband's job moved us out here, a great opportunity for us to move to Alabama. So that's why we're here. And I love it. I never thought of living in Alabama, but it's working out really great.
I love that. Yeah, I also am a transplant. I'm from Kentucky, so Indiana is just across the river from me. But yeah, Alabama is now home. It's a cool city. Mm-hmm. Birmingham is really cool. I think Birmingham is doing some really awesome things for entrepreneurship, especially Black entrepreneurs. So I'm just excited to see how this grows and bringing more awesome people to the city like you. Mm-hmm. So tell me, a little bit about your background in public health and kind of how you started this business.
Yeah. So I went to college actually to be a pediatric surgeon. Like I always wanted to do that. And that kind of stemmed from me going to a church where the pastor's wife, she was a pediatrician, and I was able to job shadow her at like 14, 15 years old. So I was introduced to healthcare very young. So that's what I pursued in college. But once I got a job working in a hospital in college, I noticed that most people were there for preventable injuries, preventable diseases, and deaths. And it was the day, and I know, there was a baby that passed away. And that was it for me, because it was a preventable injury that caused a baby to pass. And I said, you know what, from here on, I'm changing my degree to public health. And I did, and I haven't looked back. And now it's my mission to help organizations address chronic disease prevention initiatives, or use chronic disease initiatives to prevent diseases, and then also injury prevention is my focus as well. So I love what I do. I've been in public health for 12 years. And I've been in business for 5, doing exactly that, helping organizations like hospitals, medical centers, and other nonprofits with a public health or wellness focus implement their programs to improve health outcomes of communities.
Yeah, I love that. Wow. I know that must have been like hard to go through for everybody in the hospital, including the family. I know it's always, you hear about stories and things like that from, I have friends who are nurses and things, and some of them work in the NICU. So seeing, babies in positions that, could have been prevented just by a little bit more education or just, a little bit more care from the people in their community. And the people who are there to support these families. So yeah, I appreciate what you're doing, and I think it's awesome. So how, obviously, you switched your major, still within healthcare, but that's still a major switch to go from, wanting to be a surgeon to wanting to get into public health, because I feel like there's so many different avenues in public health too. So how did you, as you grew your career, what kind of made you want to get into the consulting world? I know that a lot of times people who are consultants are like, they are like, I am going to go in and like really work with businesses or work with organizations and help them grow. And so kind of what was your why for getting into the consulting space?
Yeah, so I started my business because my time working in public health, I saw the gap between the resources that were available and the people who were having trouble accessing them, whether it was, through biases that exist in the field of healthcare professionals and their biases that limit access, or really social determinants of health that cause people to not be able to have access. So with that, seeing all these things in the field and advocating for change within organizational policies, and community-based efforts, I wanted to be a part of them bridging that gap. I wanted to educate them in the way that I felt they should be educated when it came to how to effectively serve communities, how to effectively build trust with the communities so that they can participate in these programs, right? To build their knowledge on these programs existing, then for them to participate to then improve health outcomes. So my expertise is really in capacity building, helping organizations build capacity through new partnerships and helping them develop innovative community outreach and engagement strategies to build trust with communities and then ultimately to improve the health outcomes. So it's really seeing that these programs do exist. Organizations talk about the funding that they don't have and the staff that they don't have. So what can we do with what you do have? And so helping organizations identify that through this 5-step framework that I use, and also training them on empathy and bias so that they can actually build trust and serve their communities effectively is exactly what I do. I also serve as a mentor to people worldwide, men and women worldwide, who are trying to pursue public health as a career. So, yeah.
I love that. Yeah. What, as you have worked with different organizations and, hospitals, whomever is, who are your clients, what are some of the things that you have noticed that, they do have a hard time with when it comes to engaging with their community? What are some of the things that you've seen that, a lot of them struggle with?
Yeah. Number one, it's really the assumption of why they're not participating or improving their health outcomes without doing the proper screenings to determine, okay, this person isn't showing up because they really do have a barrier versus them being lazy dealing with their diabetes. So the proper assessments aren't in place for, healthcare providers based on like what I've seen. And actually I did a community outreach survey that went global, and most of them said that they had problems building trust with communities. They didn't have the proper screenings in place. They weren't tracking metrics. So if you're not tracking your metrics, you don't know how you're reaching or who you're reaching and all of those things. So I would say, building trust and the metrics, tracking metrics is what I see as one of the big issues with organizations right now when it comes to actually impacting the health outcomes of communities. We need to track everything, who we're reaching, how many we're reaching, how many pieces of resources that we're providing to such client or individual, and the referral rates and all of that, so that we can show our funders our impact, right? If we need more funding, we need to track metrics consistently. And
Metric tracking is like something that every business should do, like no matter what industry you're in. So I love that you're saying that, because it's also something that a lot of businesses struggle with, because who can dedicate the time to sit there and go through all the numbers and things like that? Like who, it's hard to find the person to do that, or allocate the time in your day to even go back through and look at, the analytics of whatever it is you're trying to do. But it shows your growth. It shows how what you're doing is affecting the community. So I love that you're working with them and showing them that is something that they need to be doing, because numbers do not lie.
Right. Absolutely.
So as you've grown your consulting firm, that's right, it's a firm. Like you would consider it like a firm. Okay. I just want to make sure I'm using the correct lingo and stuff. But as you've grown your firm, what have been some of the things that you've seen that you've struggled with, or that you overcame? And like, what were kind of the steps you took to get through those kind of bumps? Because every business has them. So yeah, what were some of the things you did?
Yeah. So one interesting thing that I didn't expect owning, my own consulting firm or starting my own business, was when you're working for corporate America or any type of other person's business, you have their audience at your discretion, right? You're showing up and presenting, you're showing up to this event, and that's their audience that their company has marketed to show up, right? So when I started my own business, I'm like, dang, I really got to start all over. Some people who worked in corporate, they follow me, and some have asked me to be, they want to work with me and so forth. But really rebuilding or building my audience was like a moment that I'm like, okay, I gotta do this, right? And I had to be unapologetically me and promote my business every day, and not worry about it, because this is business, and I'm not, whatever the reason is, it's necessary to promote my business every day, to build my clientele and share the free resources and share the workshops and share the consulting services and share the mentorship and coaching programs. So I had to realize that was one of the challenges going into it, but it's working out. We're building, and it's going well.
Yeah. And you started, what year did you start doing this full time?
I started doing consulting full time actually last year. So thank you for asking. I was working for corporate when I was still owning my business. So I had worked for corporate. I've been in business for 5 years, but I worked in corporate for a good 4 while I was, operating my business, if that makes sense. But then I left corporate last year when we moved to Alabama to pursue consulting full time, because it wasn't sustainable for me to stay in my position as a director, in a different state. Yeah. So that was the perfect opportunity for me to leave corporate. I have been wanting to leave corporate and do my business. It was just, it all made sense.
Yeah,
as a new mom,
you have a new baby. Yeah. When you're your own boss, you get to make your own hours, spend the time you want, doing the things you want to do. So I completely agree. How was that transition for you, though? I know a lot of people who I talked to, they were like, yeah, I was in corporate America, and like, it was either like they got laid off, or, it just was their time. They were retiring, whatever. But like, you seem like you were like, okay, this is it. I've made the switch. We're moving anyway. So how was that transition with you, especially since you had your business in a completely different state, too, on top of that? Because I know Alabama is hard to get your business up and going. So yeah, how was that switch for you, and like, how did you make that transition?
Yeah, so when it came to leaving corporate, it really happened effortlessly, I would say, because I was a director at a medical center. I wanted to give my people the proper heads up versus like, hey, this is my 2-week notice. And I think the requirement for me to even be considered be hired back at that company was to give a 30-day notice because of my title. So I did that. But as a new mom, my daughter was born December 2020 to 2021. Lord, I should know that, right? I didn't have the time off that I felt like I needed to heal. So it made it even better, yes, for me to leave corporate. And thank God for my amazing husband who was supportive in that. But when Gianna, like either it was 2 days before or 2 days after, that's when we found out we were moving to Alabama. And I'm like, let's do it. Why not? And he's like, are you sure? And I'm like, let's go. So it's really about like just going where life takes you. It's worked out really well. We don't have any friends or family here. Like, you're my new friend. Thank you. I appreciate this opportunity. But we're making it work. We're making it work, and me networking for friends and for business has really went well.
Yeah, I love that. Because I know it's hard to make that switch because I've seen people do it. So I'm excited by the success you've had. As somebody who is in the consulting world, like what are some tips that you recommend to people who are looking to get into even another avenue of consulting? I know still like the client attraction is the whole thing. Like what are some of the things that you would throw out there to people who are looking to get into consulting?
Yeah. So for me, I would say when I first started my business in 2018, I was afraid to show my business. I was like, nobody's going to care about impactful community outreach and engagement, but that's the way companies are meeting their metrics, right? By serving their clients and their target audience. So the tip is really lean into who you are and don't change to be a part of an industry standard. Like you're not supposed to make sense to people in your small group. People out there want you for your business and your expertise. So this has shown that I'm wanted for my business and my expertise. So like follow what's on your heart. And, if the business doesn't make sense to other people, that's okay. It makes sense to you. And, make sure it aligns with like a solid business plan. Make sure it makes sense. It's going to be profitable, but go for it. Just go for it. Just go for it.
I love that. Yeah, definitely like showing up is a big thing. I know I've talked with a lot of people who are getting into even if it's not consulting, it might be like marketing, it might be, just something where you are the business and then you are dealing with an additional like an outside source, which is probably another business that you're having to work with. So how has that been when you do go and work with other people's businesses? What are some of the things that you might shift? Because every business is different. All of their audiences are different. So obviously you are working the strategy for what they need and their goals. So how has that been as you navigate working with different entities that are all within the same field, but how has that been?
Yeah. So collaborating with partners has been great. I did a workshop called Amplify with a marketing firm, which was awesome. They're a public health marketing consulting firm. And the crazy thing is I do marketing and communications too. That's part of my 5-step community impact framework. But we collaborated, we partnered on this amazing workshop called Amplify, and she focused on marketing and I focused on community engagement, and we stuck to that, right? That was our agreement, and it turned out great. So when it comes to partnering with people who might seem to be competition, find ways, if you guys get along and all of that, that you can work together and we can all win. And because that's exactly what happened.
I love that. And I know you're doing other things other than just the consulting side of it. So you have the mentorship that you offer, but I feel like I saw something where you were offering some sort of program that people could get into. What is that? Can you tell me a little bit about, the program that you're starting, or it honestly might already be going on. But just tell me a little bit about what people can expect with that and kind of how you got that going. Because I know a lot of people are interested in those kind of like online classes and courses.
Yeah, so I'll talk about the Public Health Mentor Program. That's an online mentorship and coaching program. It's 8 weeks, and it's for current college students, recent graduates, or current professionals who are seeking support to navigate the field of public health. I've been a mentor for 4 years. Actually, it's open enrollment right now. I believe this is the 7th cohort. We've reached men and women worldwide of all different types of public health backgrounds and goals. And the goal of the program is to really help individuals go from confused to confident in their journey to public health. And over the 8 weeks, they get 16 coaching sessions with me to help them deal with whatever they're going through within the job search and, navigation of public health. We cover over 16 different topics, like resume building, tactical interviewing, salary negotiation, and then like DEI are included in those topics as well. So it's been really great. It's been like crazy to even think I would ever serve people worldwide because, when you think of that, you're like, I have to speak their language. But the individuals who've been a part of my program, I've made those different, necessary additions to the program to make sure that I have the closed captions, that I'm taking time to clearly understand what their needs are. And English is their second language, so it's not like I had to learn a second language, but they, and it's worked out really well. So very, very happy. I'm currently promoting that right now. Sign-ups are available. I'll drop the link in the chat. If you're a current college student or recent graduate, please check it out. Who's pursuing public health, please check it out.
I love that. I love that. Yeah, accessibility. I'm very big on that. I'm learning a lot more about accessibility for sure because it's something that's needed because you just never know who you're going to work with. Like whether it be somebody who speaks, another language and that's their first language, or whether that is somebody who might not be able to see or hear or whatever. So like, obviously like having those different avenues to be able to work with all different types of people is super important. I think a lot of businesses need to learn that because, that's how you grow because not everybody's the same. Everybody has different needs. So I love that. And you touched on the course that you are offering too, right? Or you hadn't touched on that yet?
Yeah. So the Impact Method is an online training program for hospitals, medical centers, health departments to use my 5-step community impact framework to reach the goals set forth within their strategic, plans of their organization. Mm-hmm. And that's to reach their target population and improve health outcomes, at least for my target audience. My target audience is chronic disease prevention, injury prevention related programs. So we use this impact framework, which includes like educating them on empathy and bias and how that can interfere with patient health outcomes, how that can interfere with patients actually showing up to appointments when we have biases and when we lack empathy, we miss the cues that we are supposed to see from individuals who need our support, who need our resources. And then it includes tracking metrics and, impacting communities through community outreach and engagement. We talk about body language, right? You've probably been to a health fair where people are on their phone versus actually being up in front of the table talking about what it is, right? Do you understand this health program that I offer? Breaking it down, health literate levels, prioritizing health literacy is really important. So we do all of that in that online training program called the Impact Method.
Yeah. I love that. Everybody's being so creative with the ways that you have to be today in order to be able to different people. Because not everybody has the time to do like one-on-one things. Some people are like, I just want the steps, give me the steps and I can do it myself. So I love that you're able to kind of offer, again, it's that accessibility thing. So just making yourself accommodating to those wherever they are, meeting them where they are. So super cool. Is there anything else that you want to talk about? Anything that you're like, okay, Theo, like I've got to tell you guys about this. Where are you going next? Anything like that?
Yeah. Well, I want to first offer a couple free resources for my, medical centers, health departments, and other public health or wellness organizations. You can go to my website, link is in my bio, and download a free resource, 6 easy ways to instantly improve community outreach. And I break it down for online methods and offline methods, to reach your target audience, because we have to be mindful of the digital divide, people who are impacted by lack of access to the internet for various reasons. So that is a really great free resource. Also, a second free resource is the organizations can schedule a 30-minute strategy session with me. If you are not meeting your strategic goals, you can schedule time with me and we'll go through that, identify any gaps, and see how we can work together to improve them. Anything else? The mentorship program, like I mentioned, we're currently enrolling for the June cohort. It's an 8-week program open to men and women worldwide. We'd love to have you guys join me. If you have any questions about any of those resources that I mentioned, please contact me directly. That's really what's happening. I just got nominated for 40 Under 40 in public health. So crossing my fingers to see what happens here. That would be amazing because, my experience in public health started from the environment that I used to live in. Also, I lived in low income areas, high crime, lack access to transportation. Also, the grocery store was getting to the grocery store was dangerous for us. We had to cross a highway to get to a grocery store because we didn't have proper vehicle. We were low income. So that is also why in community, like access to resources is important to me as well. So
I love that. Yeah, no, every time I talk to people who are in public health, I have a couple friends who went to school for that. And it's just the things that you guys are tackling. Yeah. It's like, whoo, heavy stuff, big stuff, important stuff, all good things that people need to know, and things honestly that affect more than just the healthcare industry. Like they affect a lot of different sectors across the board. Just like what you were saying with just like body language and things like that, and how people are interacting when it comes to their community and the people that they're wanting to attract and bring into their spaces. So I'm sure there's things that people who are not even in healthcare can learn from what you have to offer. I want to say thank you so much for joining. We definitely need to go like get coffee or something soon because, yes. I want to be friends with you, and I want us to, get to know each other a little bit more and see how I can support you and everything that you're doing. But just one more time, reintroduce yourself and then just let us know how we can like find and support you.
Yes, thank you. Thank you. Thank you so much. I've been looking forward to this. And again, I appreciate you reaching out to me specifically. But my name is Brittany Jenkins. I'm a public health practitioner, consultant, and mentor. I'm the founder and CEO of Jenkins Public Health Consulting. And I help nonprofits with the public health or wellness program implement their programs. And also I serve as a mentor to individuals worldwide by offering a public health mentorship and coaching program. So you can find me at Jenkins_public health on Instagram. You can find me on LinkedIn, Brittany Jenkins. And then also you can visit my website at jenkinsphc.com. So jenkinspublichealthconsulting.com.
I love it. All right. Somebody said you're losing money if you're not working with you. So everybody who is in that sector, visit her website, tap into the free resources. If you're able to go in and tap into the not free resources, do it because it's worth it. I always say, just if you have it, take the time to learn it, spend it, because it's, everything that you can get as a business owner, as a, somebody who is looking for support from somebody who has expertise in the sections that you might be lacking in. And it's okay to lack in sections. That's why there's people around who know it. So just tap in. I appreciate you for joining. I look forward to seeing you grow and, growing more roots here in Birmingham, for sure, because I know being here a year is sometimes still not enough to like get tapped into the city. I've been here 7 years and I'm like, what? Like we have that, So if you ever need to like know about a good coffee shop, bar, restaurant, let me know. I know a lot of them. I try to get out as much as I can so that I can connect with different people in different places. But thank you again for joining, and we'll be talking soon.
Thank you guys so much. Thank you for everybody in the comment section. I wasn't reading so I could stay like focused, but I appreciate the support. Thank you. Thank you.
All right, Brittany, thank you so much.